Hi there, my good people. You're very welcome to my channel, and today I have something very important that we're gonna discuss. And you know what that is? We are going to talk about nocturnal enuresis. And what is this? This is basically bedwetting. But before we embark on the main points, I want you to just subscribe there, like the video, and also turn on the notification bell so that anytime I post a video, because I'm going to post very many educative videos on this channel, so you be tuned, you get the first-hand information before someone else gets to know it. So you're very much welcome. My name is Lester. Today, I want us to really look at nocturnal enuresis, and that is basically most people call it bedwetting. What is nocturnal enuresis? So this is basically a condition whereby you find somebody pees involuntarily when they are asleep. This condition happens mostly in children and partially in teens and adults. It rarely takes place in adults, but if it happens, there must be something that leads to that. For children that are below the age of 7, it's not really a big deal. It's nothing to worry about. But if it goes beyond some given age, maybe beyond the teen age and stuff, then it can raise some issues. It can raise some questions. But it's not nothing. It's nothing to really worry about. We're gonna look about that and see how we can control it. So at some point, you could be asking yourself, what is really the cause of this issue that you're facing, and how are you going to tackle it? So one of the main causes of nocturnal enuresis, we are going to talk about a small bladder. Basically, it's recommended that we should take at least 8 glasses of water in a day, and those glasses that you're taking, that is water that you are consuming. So that means that you have to pass urine regularly. So at some point you find that the bladder is very small to hold such large amounts of urine, especially at night. So what happens, you find that the blood you are going to release the urine involuntarily when you are sleeping. We also have poor bladder control. You have some people maybe out of the busy schedules that we have during the day, you're here and there at some point, or you don't have enough time to go to the bathroom to pee, and it's very healthy to pee. So you find most people, they cannot pee regularly during the day. So you find that at night they've held a large amount of urine in the bladder. So that means that they are going to release that urine when they are sleeping. Another issue, another problem that can lead to nocturnal enuresis, it can be as a result of some underlying medical condition. That can be constipation. And we know what constipation is as a result of bowel movements. The poop in the rectum is likely to be applying some pressure on the bladder, and that makes someone to release urine involuntarily. We also have hormonal imbalance. There are hormones in the body that are very important for regulating the amount of urine that is passed out during the night, and that is vasopressin hormone. So you find that if there's deficiency of that hormone, there is likelihood of this person releasing urine during the night. We also have a narrow urethra or a blocked urethra. Remember, a urethra is a tube that allows passage of urine from the bladder. We have diabetes, and we're going to talk about diabetes. It comes in two conditions or in two dimensions. We're going to talk about that in some video later on. We have nerve problems. Remember, the nervous system is it's the central part of the body, like it controls all the activities. So if there's a hitch along the nervous system, somebody is likely to bedwet. We have UTIs, and UTIs are urinary tract infection. We're gonna look about that also in details. We have ADHD. What is ADHD? This is basically attention deficit hyperactivity disorder, and it normally affects people, and we're gonna talk about that. When we talk about attention deficit, what do we mean about that? I'm gonna make a video on the same, so stay tuned and make sure you subscribe. All right, this condition can also affect adults. Don't think that we are left. There's some adults somewhere that has this condition and they feel ashamed. They are like, what is happening? So I want to let us know what really causes this condition to happen in adults. One, it could be genetics, or we can talk about family history. So you find that if your parents used to bedwet, or this condition was in the parents, you are also likely to get this condition, because when we talked about genetics, some of the genes are passed to the offspring, and the offspring at a very high risk of also getting this condition. We have constipation, we talked about that previously. We have hormones, small bladder capacity, like your bladder cannot hold a large amount of urine, and we have failure to wake up at night. So some people are deep sleepers. Like personally, if I just sleep, that is it. If I sleep from 6, the next day I'll wake up at 6, and probably it's because of the alarm that will make me wake up. So you find that most people are deep sleepers, and maybe when the bladder, their nerves that try to send information to the brain, or you need to wake up and pee, you find some people, like, they can't wake up. So we said bedwetting. I normally see people joking. It's the only dream that comes true. You're just sleeping, you're dreaming, you're going to the bathroom, you're doing this, and then boom, you just wake up to like wet clothes. Sometimes it's a very bad feeling, because I've been through there. That's why I just came up with this video to educate some people who may be going through that condition. We have psychological stress. This is also a main issue that can make an adult to have nocturnal enuresis. You have stress, you have work stress, or you have issues with the family, you're moving from one place to another. That can also be a major cause of bedwetting. We also have medical conditions like kidney failure, kidney issues, some other medical conditions, maybe sickle cell, that can make a person to have bedwetting. Now, we have some risk factors that are associated with bedwetting. So one of it, we have stress and anxiety. So when we talk about stress and anxiety, it's one of the issue that leads to bedwetting. Somebody is anxious about something, so sometimes you find they can't control some of the activities that take place in the body. Boom, the bedwet. We have family history, we've talked about that. We have ADHD, and ADHD, most of the children that have ADHD are likely, I'm not saying that most of them they are likely to have it, but there are very high chances of them having nocturnal enuresis. What are some of the complications that come as a result of bedwetting? So they are not really complications. They are some things that can come as a result of someone bedwetting. One, rashes. Remember your pain at night, your pain on your cells, the natural way that somebody is supposed to release the pee. Okay, so you find that you're peeing on yourself, you're a lady, you're a gent, so you find that the urine at some point, it can like give you some rashes around the genital areas. Guilt and embarrassment, and this can lead to low self-esteem. I don't want to talk about this because this really affected me, but I thank those people who supported me to come through it. We have lots of interest in social activities like camping, and in most African school, kids go to boarding school. So you find a child really wants to be in a boarding school, but because of the condition that they are going through, they can't go there because they fear. And if you go to a boarding school, you are staying with other children, or you are staying with your mates in the dormitory, or in the hostel. So you find that these kids, like, they feel embarrassed, they can't participate, or if they pee, you find most of their mates, they start laughing at them, they start like mocking them, or sometimes going to sleep over. So you can't go to your friend's place for a sleepover because you're bedwetting. Now, in the next video, I'm going to talk about the remedies and how we can try to regulate bedwetting as a condition. So it's nothing big to worry about. So if mine ended, what about yours? Stay tuned, subscribe, and also make sure that you follow me in the next video. Let me see you there. Can you comment what maybe you want to know more about the